Population pre-conference on Sunday, and I was the moderator for that one as well. I'm a bit exhausted conferencing, but I have a couple of good things inside me still pushing me. So this is the last session of the day. Please note we might go a little bit beyond the time that's set. So feel free to sit back and continue to engage with us. My name is Doti Ogutu. I work at GMP Plus. I manage a program that focuses on stigma and discrimination, known as Global Partnership, and another one known as HIV Justice Worldwide that works on criminalization. So the three things, stigma, discrimination, and criminalization, is what I do at GMP Plus. So this session is on gender norms, discrimination, and criminal law, and we want to understand the common underlying determinants of health for young key populations, including adolescents and young women in Africa. This session comes at a time that is very important and critical. And if we look at how the anti-rights movement is organizing to sideline communities, vulnerable communities, that is why this session was put together. And it's been organized by WHO, UNAIDS, Global Partnership, the Global Alliance to End AIDS in Children, GMP Plus, ICW, along our Not a Criminal campaign. It is important to recognize that gender inequalities and harmful gender norms have profound impact on the health and well-being of young key populations, including adolescent girls and young women, and the young LGBTQ communities. Inequality and discrimination faced by women in their gender diversity put their health and well-being at risk, and we cannot insist any further how reducing inequalities is one of the major priorities of the 10-10-10 targets, and in this region that it is mostly important. Harassment and discrimination and violence against key population is escalating. Those of us who are in this room on Sunday, on the 3rd of December, got to hear from a panel of key populations and other key populations, and our keynote speaker, Richard, who also spoke this morning about the impact of criminalization on lives of key populations. So the current landscape calls for us to have immediate action, and this is where the Global Partnership to End All HIV-Related Stigma and Discrimination plays a critical role. The convening of UNAIDS, UN Women, the Global Fund, GMP Plus, and am I forgetting someone? No. Responded to a call at the UNPCB board delegation, the NGO delegation, where the communities insisted that countries must translate their commitment into action for advocacy to be able to meet the 10-10-10 targets. And one of those targets, as we all know, relates to stigma and discrimination and reducing inequalities. So, I would like to take this opportunity to welcome Beans, the Vice Chairperson of the Global Fund to fight AIDS, TB, and malaria, to give her opening remarks.
Thank you very much, and good afternoon, everyone. I'm sure we all know what the African Union Agenda 2063 is all about. It's about the Africa we want. And as we will be discussing, I want you to bear that in mind. What would the Africa we want look like? And I can imagine an Africa we want would be one where discrimination and stigma will be something of the past. But when I think of young people in my continent of Africa, I imagine budding success. I imagine prosperity, universal education, safe living conditions. Above all, I imagine good health for all young people as they live productive lives and become the elders of tomorrow, as they co-lead and co-create today. I imagine the leaders of today enabling these bright leaders a brighter future. While that may be the case in some other parts of the world, I see many young people left behind due to stigma and discrimination. I see the stark inequality in the treatment of adolescent girls and young women, and of lesbian, gay, bisexual, and transgender youth. An inequality that undermines and underpins the barriers that young key populations face in their access to health services. If a young person's sexual orientation, sexual activity, or gender identity is made a crime, if punitive and restrictive laws and norms limit their access to health and justice, inequality thrives. Stigma and discrimination triumph. The risk of sexual and gender-based violence rises. In turn, that can lead to such a young person being unable to access or use prevention and treatment services. Whilst we will be putting a lot of emphasis on laws and how laws discriminate and stigmatize, I think it is also important to bear in mind that even in countries where you have laws that positively promote human rights and the dignity of all people, it usually lies within each one of us and our prejudices that actually drives stigma and discrimination. And I'm talking about myself as being a lawyer, and that I believe that we should always be careful to put everything in one legal basket, but that we must look, and critically so, because so many times I've heard people speaking in my name to call it as being uncultural, that is not African culture. And I'm saying, as an African woman, that is not what I stand for, and that I will support that people do it in my name. So apart from laws that discriminate, we need to look at culture and religion as also contributing factors to what we will be discussing. We are, as we all know, in a worrying time for human rights and equality. In many countries on the continent, we are seeing a backlash against sexual and reproductive health and rights. Organized groups are targeting young LGBTQI plus people and attempting to undo the progress we have made towards women's rights. Some governments are passing punitive laws, making the lives of young girls and young members of the LGBTQI plus community more difficult and their health more precarious. Young people are determined to leap these hurdles. They are committed to making access to justice a reality. Their communities are active, they are creative, and they are leading with fresh ways of reaching gender equality and ridding Africa of HIV-related stigma and discrimination. The Global Fund backs all of these community-led initiatives through investments in human rights programs and community systems and responses. With our Breaking Down Barriers program in 15 African countries, we further expanded our support to effective human rights programs and empowered communities. The Global Fund also co-convenes the Global Partnership for Action on Stigma and Discrimination. And finally, to the young people, especially young women and young LGBTQI+, I say, we see you. In order to fulfill the promises of the healthy and successful future that you deserve, we support you in your fight to reform laws and transform gender norms. We back you. We back your aim of building on the commitments of governments, partners, and communities. We stand by you as the Global Fund. Thank you.
Thank you. And I'm sitting here and I'm sitting in the same room that I was in during the Key Population Pre-Conference, and those words are so powerful that I feel like they should have been said in that space. And so I will carry the message back to my community of key populations. Thank you so much. And we also just acknowledge the work that the catalytic funding is doing in meeting the targets. And we really applaud Global Fund for doing that, and we want you to continue doing that, and because that is the work, that is the funding that supports the work that we do in country as key populations, in as much as we work in such hostile environments. So thank you so much. So in this session, we are going to have conversations around the impact of gender-based violence and how punitive laws can increase inequalities and the risk of sexual and gender-based violence. But we'll also cover how investing in law reform and aligning that with transformative gender approaches will pave a way in addressing the inequalities that we have in amongst key populations, but also generally in the HIV response. So with that, I want to welcome Antons, who has now become a friend, and he works at WHO as the Technical Officer for Key Populations, Global HIV, Hepatitis, and STIs. Over to you, Antons.
Thank you, Dorothy, and I hope my presentation can be projected. So I would like to thank for inviting WHO to this satellite session, and our task as a technical agency is to provide technical guidance which is based on the scientific evidence. I think this is also the one of the important advantages of WHO and the role of WHO. So apologies if my presentation will be somewhere a little bit technical, but I will try to go quickly. So speaking about, so it went very fast. So speaking about the so-called structural barriers for people living with HIV, but particularly for key populations, they increase the vulnerability to HIV, hepatitis, and STI, and at the same time, they also create barriers to accessing the services. So it all starts with stigma, and all starts with stigma which is rooted in beliefs, with lack of knowledge, with so-called cultural norms, and so on and so on. And stigma is kind of is fortified by criminalizing laws, and this all creates vulnerability and barriers to access to services, resulting in higher burden of infectious diseases, but also other health problems. So WHO has developed the guidelines for key populations, which includes consolidated guidance for interventions, how to address HIV, viral hepatitis, and STI, and we have emphasized the role of so-called critical enablers or enabling interventions, which are necessary absolutely in all contexts, even before we are talking about health interventions. Of course, it needs to be provided all together, but they are more important in a way, because without those enabling interventions, also health services cannot be provided in a full mode. And those enabling interventions include removing criminal laws, reducing stigma and discrimination, empowering communities, and addressing violence. So why do we need to remove punitive laws? We all know that criminalization has real impact on the vulnerabilities to health issues, especially HIV, but also other health issues. And there is a lot of evidence published in the literature that criminal laws, for example, increase the risk of HIV infection among sex workers. The effect of criminalization on sex work includes significantly associated with fear of seeking for health services, mistreatment in health settings, lack of protection, and also increased physical violence. So that's why there are certain recommendations on how to address the criminal laws. There are overarching recommendations to remove and revise laws and harmful policies, but there are also specific recommendations specifically for decriminalizing aspects of sex work, for decriminalizing provision of harm reduction, for enabling gender-affirming care, and so on and so on. So I will not go much into details, but this is all in... Okay, sorry. So another area of barriers is related to stigma and discrimination. And again, there is a lot of evidence of harmful impact of stigma and discrimination on access to health services. And we know that UNAIDS also has developed a lot of guidance, and the global partnership also has a significant role in addressing those. So talking about healthcare settings, there are a number of interventions proven to be effective, including providing information, contact strategies, contact with key population, but also structural interventions like changing policies within healthcare facilities, and also providing trainings and changing the beliefs of and attitudes of healthcare providers. So again, there's a number of recommendations in the WHO guidelines on how to address stigma and discrimination. So speaking about community empowerment, it can take many shapes, and it's one of the 4 major enabling interventions generally. But it can take the form of including communities in the design, implementation, and monitoring of health services, providing peer education and navigation, task shifting to peer, self-care, and many other interventions, of which you know better than I do. Again, there are some very concrete recommendations in the WHO WHO guidelines. So here the slides are showing that empowering communities can also have significant impact on health for example, on sex workers. So there is a better linkage to care, there is better adherence and better treatment results. I have only a couple of more slides, so bear with me. So these are the guidelines, also the recommendations on empowering communities. So finally, violence against key population also has shown to have a negative impact on key populations, including harmful drug use, including reducing uptake of health services, mental health issues, definitely, and also other increased risk behavior. So that went well. So, and there is also evidence that violence has measurable impact on health. For example, this is also another paper on sex workers, and sex workers who have experienced violence are more likely to have depression symptoms, limited access to prevention measures, and less likely to be tested for STIs and HIV. So last slide. So this is unfortunately really is challenging, but finally talking about the young key populations, as I mentioned before, that all those barriers are applied to both adults and also young and adolescent key population. But in addition, adolescents from key populations, they face barriers related to their fast development, both physical and psycho-emotional. There are some barriers that are related to cultural or family things, such as age of consent. So that's why also health workers who might provide some services to key population, they can face legal consequences. For example, if they provide prevention services or any other services. So this requires additional and tailored interventions to address the needs of the young key population. I think I stop here, and thanks again for the opportunity.
Thanks, Antons. I think for me, what I take from there is your technical guidance document, because this is quite useful. And so I'm just going to challenge you and say, let's see how we can disseminate that technical guidance, because I mean, a lot of the work we do at community that is very impactful, but doesn't get to WHO, and the work that you also do doesn't get to the community. So having to, let's see ways that we could work together and get this technical guidance document disseminated and then rolled out within communities of key populations and adolescent girls and young women, if you have that as well, because it will be useful for us to then be able to link the two programs that we can have a massive impact. So I want to move on to the third presenter, who is Farai. This panel is full of my friends. Farai is also a friend, and he works at UNDP as he's the lead here in Zimbabwe for the We Belong Africa project. And in that project, they specifically work with ministries of health, justice, youth, gender, civil society, and other UN partners in Zimbabwe, but also in the SADC region. And there are lots of lessons to learn from the IGI project of UNDP. So over to you, Farai.
Oh, thank you, Dottie. We had prepared, I think, just some very short visuals before I deliver my presentation. But thank you so much for inviting UNDP to this panel.
As a trans woman, I struggle to get the healthcare I need to protect myself. I'd been turned away from a healthcare facility when I wanted an HIV test because of my age and gender identity. As young key populations, we experience all kinds of discrimination in our communities and at healthcare facilities. Insults, getting turned away, even violence. And we're too scared to report it because we're considered criminals in the eyes of the law. We Belong Africa's initiative has helped activists in Africa like me by capacitating and facilitating access to decision makers to talk about how to improve laws, policies, and health plans. There's still much to be done. We need ongoing support from all stakeholders, including donor funders.
Again, thank you. There are actually two of them, and I think I would like to just say I'm part of UNDP. I'll speak of
Mboka
this.
nyonso ezala na mboka na biso eutaka na
Yeah, you can please go ahead.
parlement. Soki bango baadopte yango, gouvernement e appliqué yango, je crois la population clé bakozala bien, bakozala respecté. Communauté ezolinga ko accepter bango te na ba centre de santé ba hôpital baza discriminer na misala yango tozosenga mingi surtout na l'état na biso prise en charge médicale complet eza ba population clé eza ba personnes qui va le VIH sida ceux qui ba comme na prise en charge wana je crois tokozala na génération sans sida. Na ba programme basala na parlement ba activité salema pour na ba personnes vulnérables je crois on a ndeto comme ça génération sans sida d'ici 2030.
Thank you. In addition to these visuals, I wish to just tell you that I'm part of a UNDP regional initiative that is heavily invested in supporting state entities. This means our ministries of health, our ministries of justice, our ministries of gender, to be more accountable and more inclusive of issues of young key populations groups and LGBTI individuals. We hope that through this support, countries will be able to develop laws that really reflect the input and aspirations of key populations groups in their diversity. And it is important also to note that whilst we have a group of youth in general, there is a subset of young key populations who are not being programmed for, we are not being targeted by interventions, and they experience increased vulnerability and increased risk to HIV infections. And all these outcomes are really documented publicly. And UNDP over the years has collaborated with ministries of health, our national AIDS commissions, to do very robust analysis of the legal and policy barriers that affect key populations groups in terms of accessing services. And what this has done, it has really supported the national HIV programs to identify and tackle specific legal and policy barriers, which include, the issues of criminalization, issues of stigma, issues of discrimination. And you find out that the new global health strategy talks about prioritizing populations that have been left out. And ideally, these populations are the young key populations groups. So, and within this last lap that we are in until we reach the year 2030, it's really about addressing these human rights barriers, addressing the stigma discrimination, introducing more protective laws that protect key populations groups from stigma and discrimination. And we already have the normative framework, our SADC strategies speak to the issues of addressing stigma and discriminations for key populations groups. So it's a matter of adapting all our national strategies, our key populations implementation plans, our national HIV strategic plans in the different countries to really reflect the public health commitments and the human rights commitments that are there. What we have done as UNDP is create platforms for lawmakers, for decision makers, for key populations groups, civil society organizations, to really exchange ideas and learn from one another and discuss really how we could improve the health outcomes of key populations groups, particularly with young key populations groups. And our regional parliamentarians forums have really created a platform where we open up the parliament process, we open up the process of developing laws and opportunities of how communities can participate in these processes. And the regional judges forums, they've really contributed to the just very good and very progressive judgments in the different countries. Like Dottie said, this is happening at a time when there are serious attempts by different states to introduce more punitive measures, especially even in countries where key populations are criminalized. So in countries where we see very strong judicial systems, all these attempts are really faced by strong responses from the judicial systems, and they really stop these attempts to introduce bad laws. We've also tried to contribute in, so for example, one of the popular questions that is asked is a counterpart maybe from the Minister of Health, within the senior government officials, really wants to know, how do I engage my counterpart in the Ministry of Justice? How do I talk to them about this issue of young key populations? We've really created some very interesting resources that are very useful. These are step-by-step guides that guide senior government officials on how they could integrate key populations issues in terms of how they are going to be developing their laws, or try to be very inclusive of the needs of key populations groups. So what have we learned over the years? Communities really should take and should be given the opportunity to take leadership and be at the center stage of this fight for rights. And criminalization of laws really, it increases the HIV risk and HIV rates. And again, with the appropriate level of use and investment in addressing these human rights barriers, we can indeed really reduce the HIV incidence, particularly among these priority groups. And again, if the goal is really to end HIV as a global pandemic, it is important for us to have a zero tolerance, for example, towards policies, towards programs that aim to intentionally exclude other groups. And lastly, the multi-sectoral approach itself. Where we are right now, it's important for us to engage more beyond our ministries of health. Our ministers of justice contribute much more in developing the laws. Our gender ministries, our ministers of youth have got platforms to ensure that there is inclusion of key populations groups. And it's a matter of ensuring that there is domestication of the international and together with regional ratifications that our countries want to, and develop very good laws that will promote inclusion of young key populations groups. And again, the issue of partnerships. It's important to really recognize the value of partnerships between our donor funders, our UN agencies, our government ministries, together with the civil society organizations, together with activists, to continuously create platforms where people can exchange, learn ideas, and really have frank conversation about how we can really advance the rights of young key populations groups. Thank you, Dottie.
Okay. Thanks, Farai. I have personally had the opportunity to work directly with the IGI team at UNDP. I've taken part in the judges' forums, one that happened in East Africa as well. Even the SADC meeting where we had people from different ministries. And really that space is quite informative because it gives an opportunity for technical partners to come from behind their desks and interact with the people that we are creating policies and laws and frameworks for. So, and I personally actually mentor a group of young key populations that are working with Farai. And the experience really has been, it's also enlightening for me and also educative, because as an older key population, I sometimes, forget of the experiences that you have when you are younger. And really we are working in a different age and time, and there's technology and other things. So the challenges really that they face as young key populations are quite difficult to deal with. And sometimes we find situations where even Ministry of Health don't want to deal with young key populations. So they just want to deal with the good key populations, not this other ones. Yeah, so I would really urge you, if you do have a time, to learn more about the IGI project. And that's being run by UNDP, and it's happening in 5 SADC countries. That's Zimbabwe, Zambia, South Africa, Angola, and Mozambique. I'll move on to our next speaker. His name is Vincent Dagba. He's a lawyer from Cameroon. The presentation will be in French, so kindly for English speakers, we need to have our headsets. Or Portuguese speakers, we need to have our headsets.
Bonsoir à toute la salle.
Bonsoir.
Merci. Madame la modératrice, mesdames et messieurs les participants, j'ai l'honneur de présenter le thème sur souligner qu'il est essentiel d'investir dans une réforme juridique alignée sur la transformation des normes de genre pour ouvrir la voie à une riposte égale et efficace au VIH. Le cas de la République centrafricaine. Nous allons parler du contexte de l'environnement juridique en général et de la nouvelle loi en particulier. Je vais peut-être sauter directement sur le contexte épidémiologique. Je sais que notre intervention va s'appesantir sur la situation des femmes, des jeunes, des personnes clés dont la situation épidémiologique est préoccupante dans notre pays. Le premier point, ça va toucher directement la situation des femmes en RCA reste préoccupante en termes d'accès aux services de santé, de mortalité maternelle et des VBG. La mortalité maternelle en 2017 était de 829% pour 100 000 naissances, ce qui place la RCA au 5e rang mondial avec le plus fort taux de mortalité maternelle. En 2018, un total de 900 cas, de 1969 cas de VBG et de 4256 autres cas qui ont été identifiés par Médecins sans frontières. L'âge du premier acte sexuel chez les adolescents est très précoce, sans compter aussi le problème du mariage précoce, surtout dans les milieux ruraux. Les personnes LGBT sont généralement cachées et stigmatisées. Et c'est sur ce point que je voudrais vraiment insister. C'est vrai que les personnes clés souffrent de certains comportements, de ces comportements, et nous pensons que sur le plan, ça c'est des questions de pesanteur socio-culturelle qui font obstacle à la lutte contre le VIH, qui sont des barrières pour la promotion des droits humains. Mais au niveau de la République centrafricaine, nous avons dans le Code pénal centrafricain l'article 85 qui dispose, et qui dit que tout acte entre des adultes de même sexe est considéré comme un attentat aux mœurs. Donc la loi centrafricaine, le Code pénal centrafricain, ne condamne pas systématiquement le rapport sexuel entre deux personnes de même genre. Et devant cette situation alarmante des droits humains, la République centrafricaine a su apporter une riposte sur le plan juridique par l'élaboration des textes favorables à la lutte avec le concours de la communauté internationale, notamment l'ONU-SIDA, et en prenant en compte le fait que les précédents échecs sont dus à la non prise en compte de la transformation des normes du genre. Donc, dans la législation nationale, nous avons des textes qui sont liés aux droits humains, en commençant par les accords et traités qui sont ratifiés et signés par le pays, nous avons également les dispositions de la Constitution, de notre Constitution du 30 août 2023, qui disposent qui garantissent la protection des droits humains et qui stipulent que lorsque nous ratifions, notre pays signe ou bien ratifie un accord ou bien un traité, ce traité-là est d'application immédiate. Ça veut dire que notre pays accepte que la protection des droits humains soit assurée avec efficacité. Il y a aussi le Code du travail, en ses articles 313 à 318, qui assure la protection du travailleur dont le statut sérologique est positif depuis l'embauche et pendant l'exécution du contrat de travail. Le Code de protection de l'enfant, en son article 67, protège l'enfant contre toutes les formes d'exploitation. L'accès à la justice est devenu une réalité et a été renforcé par les dispositions de l'article 12 de la loi sur l'aide légale. En effet, les PVVIH, les personnes vivant avec le VIH et les populations clés sont considérées comme des bénéficiaires principaux de cette loi sur l'aide légale. Concernant maintenant la nouvelle loi dite la nouvelle loi VIH comporte des articles qui traitent de plusieurs points. L'accès à l'information et à l'éducation, l'accès aux soins, ce qui traite des adolescents et jeunes, du genre et du VIH, de la stigmatisation et de la discrimination, des droits des PVVH, du VIH en milieu de travail et des comportements interdits. La loi aussi a introduit de nouveaux concepts, parce que dans l'ancienne loi, on ne parlait pas des populations clés. Dans l'ancienne loi, on n'a pas prévu le dépistage des enfants mineurs. Donc, cette loi-là, cette nouvelle loi qui a été promulguée en 2022, est venue avec des innovations. Mais je voudrais insister un peu sur cet aspect. Le processus d'élaboration de cette nouvelle loi a été vraiment un signe de solidarité nationale. Parce que c'est tous les acteurs qui se sont mobilisés autour de cette loi pour que, depuis le début du processus, cette loi-là a été de bout en bout, dans un cadre participatif. Donc, tous ceux qui sont des acteurs au niveau du pays ont contribué à l'élaboration de cette loi. Et jusqu'au niveau de l'Assemblée nationale, avant de déposer le projet de cette loi sur le bureau de l'Assemblée nationale, le pays a organisé des activités de sensibilisation. Par exemple, pour que l'aspect genre soit vraiment pris en compte et vérifié, une réunion a été organisée avec les agences du système des Nations Unies. Donc, tous ceux qui sont dans ce programme de genre ont participé à la validation de cette loi. Et ensuite, au niveau de l'Assemblée nationale, les députés ont été préparés avec des activités, des ateliers, pour que le moment venu, au moment du vote, cette loi-là soit votée. Et effectivement, c'est ce qui s'est passé lors du vote de cette loi. Tous les acteurs étaient là, les députés ont voté à l'unanimité. Donc, je ne voudrais pas revenir sur les dispositions, mais il y a des articles qui traitent de tous ces points, Aussi, nous savons que grâce à la combinaison de la nouvelle loi VIH, des textes internationaux en matière des droits humains et la loi sur l'aide légale, le RCED c'est-à-dire le réseau centrafricain sur l'éthique, le droit et le VIH, qui est initiateur de cette loi, intervient à travers les parajuristes, les cliniques juridiques et la saisine des juridictions avec un dispositif renforcé d'avocats pour que la transformation des normes de genre puisse assurer l'efficacité, l'égalité et l'équité de la lutte. Il a lieu de mentionner en passant un exemple concret des effets positifs de l'amélioration de l'environnement juridique. C'est le cas d'un élève policier à qui on avait refusé l'admission à l'académie de police à cause de son statut sérologique, mais grâce au rappel des dispositions de la nouvelle loi sur le VIH qui protège contre ce genre d'actes de discrimination, le jeune policier a été rétabli dans ses droits et grâce au plaidoyer mené par le réseau centrafricain des personnes vivant avec le VIH qui s'est associé au LCD pour mener les démarches afin que ce policier-là, cet élève policier, soit rétabli et qu'il puisse continuer sa formation. Et ce n'est pas l'unique cas. Il y a aussi un cas similaire. Il y a des jeunes douaniers, il y a au moins 11 jeunes douaniers qui ont été, qui ont passé le concours, qui sont admis. On les a passés à un examen médical et par rapport à leur statut sérologique qui était positif, on les a exclus. Ça aussi, ce dossier a été transmis au tribunal administratif qui a pris la décision de rétablir ces jeunes douaniers dans leurs droits et ils ont continué à leur formation. Il faut également préciser que les partenaires se sont engagés pour mobiliser des financements afin de favoriser l'accès à la justice et l'application de l'aide légale. Sur ce point, la République centrafricaine a pensé que si nos partenaires se mobilisent pour financer l'aide légale, c'est-à-dire les frais de justice aux victimes, nous aussi, de notre côté, notre pays s'est engagé à investir, à créer une ligne budgétaire pour ce chapitre des frais de justice. Et le montant est de 14 millions de francs CFA. Nous allons aussi parler des personnes clés. La loi dans notre pays ne condamne pas, je l'ai dit tout à l'heure, ne condamne pas, ne réprime pas l'homosexualité. C'est vrai qu'il y a une forme de non-reconnaissance, mais en tout cas, notre loi, notre législation locale, nationale plutôt, n'interdit pas la pratique de l'homosexualité. Mais dans le cas d'espèce, nous savons qu'il y a une association des personnes, des hommes ayant des rapports sexuels avec les hommes, a été reconnue au niveau du ministère de l'Intérieur et même travaille avec le ministère de la Santé, travaille avec les organisations de la société civile, travaille avec le CNLS. Ça veut dire que le pays ne ferme pas la porte totalement avec les populations clés. En conclusion, la RCA a fait des avancées notoires dans la mise en place d'un environnement juridique favorable avec la prise en compte des normes de genre pour l'efficacité de la riposte. La stigmatisation et la discrimination sont atténuées. Les populations clés ne sont pas poursuivies à cause de leur orientation sexuelle. Avec cet élan, les personnes vulnérables et les populations clés s'impliquent déjà dans plusieurs activités et ont accès aux soins et à la justice. Il est important aussi de souligner qu'il est essentiel d'investir dans une réforme juridique alliée sur la transformation des normes de genre pour ouvrir la voie à une riposte égale et équitable au VIH. Malgré ces avancées, il faut le dire, il existe encore des défis à relever. Donc, je voudrais revenir encore sur ce point-là. Avec cette loi qui a été promulguée en 2022, il y a eu des avancées vraiment significatives. Je peux prendre un exemple concret. C'est le bureau du RCED a pu saisir la justice sur 26 cas sur 26 dossiers. Donc, nous pensons que, en tout cas, il y a un effort qui est en train d'être fait pour la protection des personnes vulnérables et des personnes clés. En conclusion, la RCA a tenu compte de ces normes de genre et intégrées dans la deuxième loi. Cela a un impact actuellement sur l'environnement juridique et permet de lever les barrières à la prévention, au dépistage, au traitement et de lutter efficacement contre le VIH. Je vous remercie.
Thank you very much. It's important to note that CAR is one of the global partnership countries, and the work that you're doing there really speaks to one of the Not a Criminal campaign that GNP Plus runs. And on 28th of February is the day that is marked to celebrate that HIV is not a criminal, because we still have countries where you are criminalized for your HIV status. Another thing I just want to mention based on your presentation is around the work in the work setting, because Global Partnership looks at 6 different settings, and one of those that you talked about is the workplace, which is quite powerful. And we are seeing also interventions in Uganda, where NAFOFANU, the National Network of People Living with HIV in Uganda, have developed a policy together with the Uganda Federation of Employers, and it's been adopted by the National AIDS Control Council, and that manual will actually be rolled out to employers throughout Uganda, so that then communities don't face stigma and discrimination, and they're not laid off from work based on their HIV statuses. You can tell it's evening because my voice is going down, right? So I want to invite Umanyana, and I just want to say thank you for coming to close this session for us. Umanyana is the head of human rights team at UNAIDS. I was going to say the other way around. Yeah, but thank you so much for coming here today and for the work that you're leading around stigma and discrimination with your team at UNAIDS. So if you could give us your closing remarks, and I'm being reminded that we are out of time.
Thank you so much, Dottie. And I must thank everyone for coming. The kind of late session in the day is always a tricky one, but we appreciate you coming and giving your attention to the speakers. Thanks to the speakers. Bans, thank you so much for coming from the Global Fund, such an important stakeholders for communities, and your commitment, your personal commitment to addressing stigma and discrimination, and to supporting communities to do the work that they do and to let communities lead. That's what we're saying in this conference, and you've confirmed that commitment from the Global Fund, and we appreciate that. Also, I appreciate your attention to young people and the need, and what all the speakers have talked about, the need for young people in particular and young key populations to be supported, to be at the table with decision makers, and to have services that are tailored to them. Farai, thank you for your work at the UNDP, which is a strong partner of the Global Partnership, and UNAIDS in our work on human rights. UNAIDS, as you know, is a joint program, and UNDP leads on human rights. So that work is well known in Africa, in particular around judicial reform, the training of judges, and the training of communities to enable them to engage with the judicial system in order to make those changes. We talk about punitive laws. They are challenged by communities. We have many examples of communities engaging in strategic litigation to change those laws that impact them and affect the way in which they interact with the health system and many other systems. The Global Partnership talks about the workplace, healthcare, essentially all the places in which you interact with the state must be free of discrimination. Vincent, thank you for sharing your experience from CAR. There are many good news stories. We always talk about the success of the work that has been done in CAR by communities. Vincent talked about the HIV law, which is extremely progressive. And we should learn. I hope that we're able to learn from the work that's being done in CAR, where a specific HIV law that directly tackles stigma and discrimination and ensures that in the workplace setting, for example, people can have redress where they experience discrimination. They have recourse to a law that's specific to them and their experiences. And that came out as a result of the kind of work that's being done by all of us on this panel and funded very much by the Global Fund. Biens, we also need to ensure that the Global Fund is leveraging other funding to come into communities. That's extremely important. Antons, I think we're also buddies now. We've met many times. Thank you for sharing that technical knowledge and experience and tailoring it to communities. Because as Dottie said, it's not helpful if these technical documents stay at the WHO headquarters in Geneva. We need to feel them, we need to experience them, we need to have fact sheets and toolkits that we are able to engage with as communities. And I think the challenge was given to you to make sure that that's the case. But thank you for sharing that technical information and for showing how stigma and discrimination appears in different spaces, in particular the healthcare setting, which is so important for many people who are living with HIV and who are vulnerable. So thank you all. And GNP Plus for hosting us with this panel and for the role that you've played. I just want to take this space to say thank you to GNP Plus for the role that they've played in this conference, in leading communities. We talk about, this is our report for World AIDS Day at UNAIDS, Let Communities Lead, and GNP Plus is a shining example of this. And we must continue to support those organizations. So I want to thank you all for being here this afternoon, and I will close the session here. Thank you.